You're listening to Med School Radio. Welcome back to Med School Radio. We are going to be looking at educational objectives for microbiology. Okay, let's start. Tenofovir is a nucleotide reverse transcriptase inhibitor that is a common component of HIV therapy. This drug is generally well tolerated but may occasionally cause damage to the proximal tubule of the kidney, leading to acute kidney injury and or proximal tubule impairment. For example, phosphoruria, glucosuria, proteinuria, and water retention. Biopsy typically reveals a normal glomerulus and renal interstitium, but damage to the proximal tubule. Listeria monocytogenes is a facultative intracellular gram-positive rod that produces a very narrow zone of beta hemolysis on blood agar, shows tumbling motility at room temperature, and can grow at refrigerated temperatures. Intracellular pathogens such as Listeria are largely eliminated by the cell-mediated immune response, for example T cells, macrophages, and cytokines. Patients with impaired cell-mediated immunity are at risk for invasive Listeria infections. Okay, what does it mean if you have a patient who has hepatitis B core antigen IgM negative and hepatitis B surface antigen negative, but is positive for hepatitis B surface antibody? This reflects immunization against hepatitis B, not prior hepatitis infection. Hepatitis D virus, HDV, is a replication defective RNA virus that is capable of causing infection only in the setting of co-infection with hepatitis B virus, or HBV. HBV provides hepatitis B surface antigen for the HDV envelope. Pulmonary actinomycosis develops most commonly following aspiration and can be confused with lung abscesses, malignancy, and tuberculosis. Microscopic findings include filamentous, branching, gram-positive bacteria, and sulfur granules. Campylobacter jejuni is an oxidase-positive, curved, gram-negative rod that is a leading cause of gastroenteritis. The pathogen is a zoonotic organism, most commonly contracted by consuming contaminated, undercooked poultry. Cases are marked by fever, abdominal pain, and diarrhea that may be bloody. Leptospirosis is a zoonotic infection caused by the motile spirochete Leptospira. Transmission primarily occurs when humans come into contact with water contaminated with animal urine during outdoor recreational or occupational activities. Patients classically have a mild, self-limited flu-like illness, but may develop more serious complications such as renal or hepatic failure. Lysogenic bacteriophages are responsible for converting non-pathogenic Corynebacterium into toxigenic Corynebacterium. Toxigenic strains elaborate the diphtheria exotoxin, which causes pseudomembranous pharyngitis and potentially life-threatening systemic effects, for example, myocarditis and neuritis. Viridin streptococci are normal inhabitants of the oral cavity and are a cause of transient bacteremia after dental procedures in healthy and diseased individuals. In patients with pre-existing valvular lesions, viridans streptococci can adhere to fibrin platelet aggregates and establish infection that leads to endocarditis. Chagas disease is a protozoal illness that is endemic to Latin America. Patients in rural areas are at greatest risk when their houses harbor the vector, which is the triatom bug, in adobe walls or thatched roofs. Acute infections are often asymptomatic, but patients can develop Chagas cardiomyopathy, for example, heart failure, ventricular arrhythmias, ventricular aneurysms, several decades later. Haemophilus influenzae is a gram-negative coccobacillus that requires both X factor, hematin, and V factor, NAD+, to grow. H. influenzae type B has an anti-phagocytic polysaccharide capsule, which allows it to spread hematogenously and cause invasive disease such as septic arthritis and meningitis. Giardia lamblia causes injury to the duodenal and jejunal mucosa by adhering to the intestinal brush border and releasing molecules that induce a mucosal inflammatory response. Secretory IgA, which impairs adherence, is the major component of adaptive immunity against G. lamblia infection. Conditions causing IgA deficiency predispose patients to chronic giardiasis. Scabies is a human mite infection associated with a pruritic papular rash with excoriations and burrows. Patients with impaired cell-mediated immunity, for example HIV, often develop a very high mite burden. Treatment with topical permethrin and or ivermectin is generally curative. Hematogenous osteomyelitis is predominantly a disease of children that most frequently affects the long bones. Staphylococcus aureus is implicated in most cases secondary to a bacteremic event. Streptococcus pyogenes, which is group A streptococcus, is the second most common cause of hematogenous osteomyelitis. The most common one is hematogenous osteomyelitis. Let me make a correction there. What I wanted to say was Staphylococcus aureus is implicated in most cases secondary to a bacteremic event. Streptococcus pyogenes is the second most common cause of hematogenous osteomyelitis. Enterohemorrhagic Escherichia coli, or EHEC, is primarily contracted after eating undercooked ground beef. EHEC produces Shiga toxin, which causes hemorrhagic colitis and can lead to hemolytic uremic syndrome, or HUS. HUS is characterized by acute renal failure, thrombocytopenia, and microangiopathic hemolytic anemia. Children aged less than 10 are at greatest risk. Pneumocystis pneumonia is common in patients with advanced HIV and usually presents with slowly worsening cough and dyspnea, hypoxia, and bilateral interstitial infiltrates. Diagnosis requires visualizing the organism in respiratory secretions using special stains, for example, a silver stain. First-line treatment is trimethoprim sulfamethoxazole. Dengue viruses are single-stranded RNA viruses with 4 different serotypes. Primary or first infection can be asymptomatic or cause a self-limited disease in most adults. Secondary infection is due to infection with a different viral serotype and usually causes a more severe illness. Thank you very much.